Have you ever been admitted to the hospital with severe anemia and thought to yourself, my blood count is low already. Why does the hospital keep taking so much blood? Aren't you making my anemia worse? If you've ever wondered that, you're not alone. Hi, I'm Dr. Christopher Brennan with Long Island Aftercare, and in this video I'm going to explain why blood tests are so important when you're hospitalized with anemia, and why those blood draws are usually not the reason your blood count is low. One question I hear quite often from patients being admitted with severe anemia is, Doctor, if my blood count is already low, why are you taking so much blood? Won't that make my anemia worse? That's a very reasonable question. The good news is that the amount of blood we take for laboratory testing is actually very small. Most blood tubes contain only a few milliliters of blood. Even when multiple tubes are collected, the total amount is usually much less than people imagine. To put it into perspective, a standard blood donation removes about 500 milliliters of blood. The blood we draw for routine hospital testing is only a tiny fraction of that amount. When someone is admitted with severe anemia, those blood tests are extremely important. They help us determine why the blood count is low, whether the anemia is stable or worsening, whether there is active bleeding, and whether treatments such as iron, medications, procedures, or blood transfusions are needed. For example, we may order tests to look for iron deficiency, vitamin deficiencies, kidney disease, blood loss, hemolysis, infections, or other medical conditions that can cause anemia. The results help guide treatment and help us determine whether a blood transfusion may be necessary. We may also need to monitor your hemoglobin level over time. Sometimes a single blood test only gives us a snapshot. Repeating laboratory tests helps us understand the trend and make sure our treatment plan is working. Now, it is true that frequent blood draws over a long hospital stay can contribute to blood loss, especially in critically ill patients or patients requiring extensive laboratory monitoring. That's why healthcare teams try to order only the tests that are medically necessary and avoid unnecessary blood work whenever possible. In fact, many hospitals use smaller collection tubes, combine laboratory orders when possible, and carefully monitor how often blood is drawn in patients with significant anemia. Our goal is always to balance obtaining the information we need to keep you safe while minimizing the amount of blood we draw. So while it may seem like we're taking a lot of blood, the amount collected for testing is usually very small compared with the amount of blood already circulating in your body, and the information we gain is often critical to diagnosing and treating the cause of your anemia. The bottom line is this: the blood tests are not being ordered to make your anemia worse. They're being ordered to help us understand why you're anemic, monitor your condition, and provide the safest and most effective treatment possible. If you ever have questions about why a test is being ordered, please ask. Understanding your care is an important part of your healthcare journey. I'm Dr. Christopher Brennan with Long Island Aftercare. Our mission is to help patients and families better understand hospitalization, medical testing, treatment decisions, discharge planning, recovery, and the healthcare system itself. Remember, knowledge is power when it comes to your healthcare. Follow us, share our content with friends and family, and visit longislandaftercare.com. Be sure to scroll down to the blog section where you'll find additional videos, articles, guides, and real-world healthcare education designed to help patients and families better understand the healthcare journey. Thank you for watching, and we'll see you in the next video. And be sure to follow Long Island Aftercare on Facebook, YouTube, Instagram, and our other social media channels so you never miss new content, education, resources, and helpful tips.